Next, the first debate between New York Senate candidates First Lady Hillary Rodham Clinton and Congressman Lazio. Last night's debate took place in Buffalo, New York. It was moderated by Tim Russert, host of NBC's Meet the Press, and hosted by NBC Decision 2000. It's about an hour.
Good evening and welcome to WNED-TV Public Television Station Studios in Buffalo, New York, the scene of the first Senate debate. Our candidates are here: the Republican nominee, Congressman Lazio, the Democratic nominee, First Lady Hillary Rodham Clinton. I'll be joined tonight in the questioning by Bob McCarthy of the Buffalo News and Scott Levin of WGRZ-TV 2. Each candidate will be allowed 90 seconds to respond to a question. The other candidate will then have 45 seconds to offer a response. By a flip of the coin, the first question goes to Mrs. Clinton. Mrs. Clinton, you have no voting record as such. People, in order to determine how you will behave as a legislature, look at your principal policy initiative, health care. I want to ask you a couple of questions about that. In 1993-94, you proposed a health care bill that was very controversial in this state. The man that you want to replace, Daniel Patrick Moynihan, had this to say, and I'll show you on your monitor and I'll show our voters. The administration's solution was rationing, cut the number of doctors by a quarter, specialists by a half. And he went on to say teaching hospitals would be at risk. The Finance Committee passed a bill in '94 to provide financing for the medical schools and the teaching hospitals. The Clinton administration rejected the committee bill. Why did you propose cutting the number of doctors by 25%? The number of specialists by 50%.
Well, Tim, let me start by saying that I'm delighted to be here this evening with you and with Bob and Scott and the audience, and I really appreciate this opportunity to talk about the important issues in this race facing New York and our country. You know, in 1993 and 1994, we did attempt to reform our health care system to provide universal health care coverage. Now, as everyone knows, that was not successful. But we learned a lot, and I in particular learned a lot about what we can do step by step to try to reach the goal of providing quality, affordable health care. And here in New York, there isn't any more important part of the health care system than the teaching hospitals, which are really the crown jewels of the health care system. We did propose a funding stream that would have provided additional funds to the hospitals, but we still have not done enough 6, 7 years later. Senator Moynihan is absolutely right to propose a piece of legislation that would guarantee that our teaching hospitals will be funded to perform the functions that they do, which cannot be performed within the market at a profit, namely training our doctors and nurses and providing health care for the sickest of the sick and doing the research we all benefit from. You know, when we made a proposal, Tim, it was to be a starting point, a basis for argument and compromise within the legislative process. But I've always been committed to ensuring that we have the specialty care that's needed, and particularly that we support our teaching hospitals.
When the 57 teaching hospitals and the 12 medical schools in the state, with the Democratic governor and Democratic senators, say the bill would have been devastating to New York health care, when you were not a New Yorker, will you now change your view that you are a New Yorker?
Well, I wanted to emphasize that I believed in teaching hospitals then. I did have a piece in the legislation, as I recall, that would have provided funding for the teaching hospitals. And I have supported Senator Moynihan's plan, which is a plan that would provide what's called all payers payments for our teaching hospitals that would guarantee that the places that do the work that all of us rely on for the quality of our health care system will be given the funding that they needed. And I supported that in a different form, but I am fully committed to it now.
Mr. Lazio, your response.
You know, a New Yorker would never have made that proposal. In New York, we say you got to tell it like it is. And the way it is that Mrs. Clinton has had two opportunities to make policy, one on health care and one on education. And on health care, it was an unmitigated disaster. Even the people in her own party ran away from it. And worse still, it would have been a disaster for New York. Would have led to health care rationing, would have destroyed teaching hospitals, would have led to all types of unintended consequences, perhaps. But the bottom line is, it would have been terrible for New York. But it didn't stop just there. Mrs. Clinton also stood silently by when the president exercised his only line-item veto to hurt Medicaid going to New York. And that's the true picture in this case.
My next question is for Mr. Lazio. You too cast a critical vote in your career as a congressman. There is a physician and a congressman named Mr. Norwood who joined together with Democrat John Dingell and presented legislation which would allow patients, to sue their HMOs if they were not treated properly. There are 31 congressmen in the state of New York. Only 3 opposed that legislation. One of the 3 was Rick Lazio. Why?
First of all, there's 2 different versions of the Patient's Bill of Rights that I supported. And let me tell you, as somebody who has had a health care crisis in his family, my dad was a stroke victim, and for many months he was in the hospital. I think I'm pretty sensitive to the need to have access to specialist and quality care. And that's why the 2 versions that I supported had all those things. The difference is we don't want to drive more people onto the rolls of the uninsured. Yeah, sure, a vote for that bill might have pleased some editors and some editorial boards, but it wasn't the right thing to do. Ask the real health care experts right now, and they'll tell you that was bad legislation. We need to help deal with the issue of the uninsured, because every single day, 3,000 more Americans fall onto the rolls of the uninsured under this administration. I support a strong Patient's Bill of Rights. I support a right to sue, but I don't support unlimited damages and unlimited lawsuits. I want to make sure that patients get the care that they need in a timely fashion. I don't want to force people to have to languish in court.
When 28 New York congressmen vote one way and you vote another way, it's suggested that you did that because you're more loyal to the leadership of the Republican Party in the House than you are to the constituents of New York.
I don't think anybody can rationally say that, Tim. In fact, if you look at my record, it's a record of independence in the House. Whether it's standing up on the environment or on funding for the arts, on a whole range of other issues, I've been able to stake my claim and have a record that's reflective of New York. You know, I was also the person who sponsored legislation to help cancer patients. Also the person that helped root out Medicare fraud with legislation. I've been a doer. I haven't been passive. I've gotten things done. And yes, sometimes that means you have to stand on principle, even when it's not politically popular. But in this case, we did protect patients. 2 different ways. The end result is that you've got to get the job done. You've got to make progress. And I'm proud of my record.
Mrs. Clinton, your response.
Well, you know, Tim, listening to the Congressman's response reminds me of a word I've heard a lot of this past year, chutzpah. He stands here and tells us that he's a moderate, mainstream, independent member of Congress. Well, in fact, he was a deputy whip to Newt Gingrich. He voted to shut the government down. He voted to cut $270 billion from Medicare. He voted for the biggest education cuts in our history. Time and time again, when he's had a choice to make, particularly at the critical turning point, when our country was really on the line with Newt Gingrich's contract with America, he stood with the Republican leadership and Newt Gingrich. Once again, he's standing with the Republican leadership, not just against the rest of the congressional delegation, but 200 health groups, including doctors and nurses.
The next question is from Bob McCarthy of the Buffalo News.
Good evening, Mrs. Clinton, and welcome to Buffalo for tonight's debate. I'd like to start out tonight talking about something we've heard you talk about a lot over the past few months, and that's the upstate economy. And in your discussions about stimulating the upstate economy, you often cite the need to reduce the state's high local tax burden. At the same time, some of your prominent Democratic allies in executive positions, such as Buffalo Mayor Masiello, point to a number of root causes of those high taxes: binding arbitration stemming from the Taylor Law, multiple bidding requirements from the Wicks Law, or failure to enact public employee residency requirements. Granted, these are Albany issues, but Masiello and top business leaders cite them as chief causes behind your concern over high local taxes. Do you agree with the mayor on these points? And will you use your leverage as a senator and a party leader for change on these matters, despite your wide backing from the state's public employee unions?
Well, Bob, I'm a very strong supporter of the changes that are needed to stimulate the upstate economy, particularly here in western New York and in Buffalo. And many of those changes can only take place at the state and local level. That has to be left to local officials and I would certainly work with them to remove any barriers that exist. In addition to state and local tax